You may have already seen signs at your local pharmacy offering the flu shot. And I know schools here in Oakland and across the country are already looking ahead to the upcoming flu season. The last flu season we had here in California was especially deadly for our state. More than 200 people died as a result of the flu. Health officials called it the worst flu season in a decade. And now they want to make sure everyone stays safe this year. Happy to be joined this morning by Dr. Misra. We're talking about the flu shot. Thanks for being here.
Thank you for having me again.
I read that the CDC recommends we get a flu shot by the end of October. Is there such a thing as getting it too early?
There is, because the peak, or I should say the maximum coverage that vaccine can afford, can tail off after a certain number of months. Sometimes when the flu is especially bad, like it was last time, they actually recommend a booster or a second one, January or so, depending upon, of course, when they got it.
So when do you tell your patients to get one?
So, the recommendation always is for susceptible patients, which is first to say extremes of ages, children, and of course something we'll cover, and of course older people or anyone who's immunocompromised for whatever reason, medical conditions, for example, that may make someone more susceptible to be getting sick.
Okay, so check with your doctor.
Yeah, sure. So there's some fine-tuning there.
Okay, but end of October, according to the CDC, is a good target.
Correct, yes.
Let's talk about last year's flu season. Do you expect it to have any effect on this year's reaction by the public?
It's hard to say. I mean, I always get this in my office or otherwise, just, whenever I'm asked this. Some people say, well, it wasn't very effective, not getting it this year. Some people say, goodness, we had bad outcomes, so I better get it.
Right.
We encourage everyone to get it. It's a killed vaccine. It's safe. It's, as I said, sometimes even given twice in the same flu season.
Are you seeing any indications from other countries that are already using the flu vaccine as to how effective it might be this year, or is it too early?
I cannot comment on that explicitly yet, but I do know this. The World Health Organization, the WHO, has amended some changes to the quadrivalent vaccine for what's called, you probably remember back in 2009, I think it was the H1N1, well, what's now the H3N2. It's always trying to, in other words, the desire is to catch up with the said virus strain that we're concerned most about. So it's been updated. So in lieu of just this reason, not just of what may happen here, but what's been going on overseas. And many times those are tea leaves or indicators or predictors of what will happen in our country.
How close are researchers to a universal flu vaccine?
Well, the issue is that the vaccine, or I should say, it's generated best on the estimations of what strain is going to get us. So if you looked further into it, there's also a different vaccines recommended for the northern or southern hemisphere based on, again, predicted strains that would hit those said areas.
And one thing that's been missing for a couple years is the nasal flu, which avoids the shot.
Correct.
Do you prefer one over the other, and why?
Well, I understand people who may have a fear of needles and hence be reluctant to get anything. So as opposed to getting nothing, I'd absolutely prefer that they get at least the nasal one. Their efficacy is essentially the same. So I'm agnostic in that sense. I'm not particularly biased, but I just want people to get the vaccination.
Okay, and you mentioned that it's not a live vaccine. It's not a live flu inside the actual shot. I still hear people who say, I got the flu shot, then I got sick. Your comment on that?
Sure. So it's not an impenetrable veneer to all illnesses that could happen. It's a very targeted vaccine against a specific concerned viral strain. So you can get other problems. It's not to say you couldn't get sick from something else. One can. And often it seems to coincide, and people have, this is an aspect of correlation, not causation. I think that's where really people should understand what that means.
And finally, when do you get your flu shot?
Typically around October.
Okay. All right.
And then depending on how bad it's going, the flu season, that is to say, I may get a second.
Okay, get a booster later on. Dr. Misra, always good to talk with you.
Thank you very much.